All right, I thought y'all would want to know more about the epidural since a lot of people haven't seen it and it's fairly new to the PICU. So this is what the epidural looks like, the new container with a handle, and it can also screw onto the back of your IV pole if needed. It will also have a card attached to it that will let you know the attending physician that can assist you if you have any troubles with it, and who to call for nights and weekends. So this is the container. It has a lock right here. This is where you unlock it. And then it also is going to have a lock right here for the cassette, and I'll show you that in just a second. So obviously this is where you hang your bag, and then you will connect your epidural tubing, which will have the little gray piece. You are going to have to unlock the cassette when you're changing it out. So this is the little silver lever, and you're going to want to push that down, and then you want to connect the little gray connector right here. Push this in until it clicks, and then you want to push this lever back down and make sure that it clicks. Then you'll need to lock the cassette in place. So I showed you the little lock earlier right here. This is where you want to lock this in place. Otherwise, when you put it together, it will tell you your cassette is not locked, and then you'll have to undo it, and nobody has time for all that. So you're going to lock your cassette in place. You won't be able to pull the lever all the way down. So then you'll want to make sure your tubing is coming out. It can come out the bottom right here, and it can also come out the side, if you can see right here. So we're going to lock this. Now, everything's good and closed. So this is your power button right here. You just want to push that, and it should power on. And this pretty much should already be set up when the patient comes downstairs, but if for some reason if this doesn't, then I just wanted to show you. So it's going to ask you if you want to start a new patient, and you would click yes. I'm hoping y'all can see this. And then you would have to choose peds acute pain, and then hit select. I'm trying to read this backwards. And then you would need to choose, this is an epidural and it's continuous. We probably won't have a bolus in here. So just hit select. And then you would need to choose what exactly the drug is. So then if you're ever asked to enter the password, it's always going to be 456. So they kind of proved it difficult having to enter 456. It should have been 111. Not important, 456. Okay, so then it just wants you to verify this information. Once you verify that it's correct, you can hit yes. If it's not, obviously click no. And then it's going to tell you that it's programming this particular pump, and then it wants you to review the settings. You can notice up here that it still says stopped, so it's not running. So you'll have to review the settings. So it's going to verify that you want your continuous rate at 5, your reservoir volume is at 195, and then you're going to press next. Do you want it to prime the tubing? If your tubing is not primed, obviously you would choose yes. We're going to say no, and then we're just going to click start pump, yes, and then it'll tell you pump is running. Up here at the top in green, it will say running. If for some reason that you needed to stop it, this is your start stop button. You would just put stop pump, yes. Pump is stopping, this turns red again. It will ask you after, I can't remember exactly how long it is, if you still want it to remain stopped, and it will beep at you and it will tell you. But that is pretty much it. It's pretty simple to use. If you need to change the bag, which you would every 24 hours, and the tubing changed every 4 days. And I think that's it. So if you have any questions, just let me know.